Phoebe. I'm 26 years old. I'm currently doing modeling in events, and I'm also an endorser. I heard about CSA Medical from my friends who undergone also some procedures here by Dr. Contessa. And I also see it online, like in YouTube. I watch their vlogs of how they do their procedures. My nose, my biggest insecurity, of course, I want to try to do some threads and fillers. And my under eyes are kind of deep set, so I also want to try to do some fillers there. And of course, to pout my lips a little bit. So we'll be showing you what we will do on my face, some subtle enhancement. This won't be a drastic change. And yeah, you can watch it on our YouTube channel. Please subscribe to Dr. Contessa, and of course on her socials, Instagram and Facebook.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a first-time guest. Let's all welcome Phoebe. Hi, Phoebe.
Hi, everyone. Hi, Dr.
Yeah.
Good morning.
And also, we're welcoming back Dr. Roxanne.
Yeah.
Hello, everyone. Good to be back.
And she's thinner, slimmer. Okay. So, Dr., we have Phoebe here. When I saw her, I thought she's a high school student. But when I asked her age, she told me she's...
Almost 27.
There you go. She's in her late 20s now, right,
Yeah.
Doctora? Okay. For her age, of course, basically, we're thinking it's not an anti-aging treatment, right? It's more of enhancements,
Yeah.
further beautification, highlighting the beauty parts of the face, o, di ba? Especially the center of the face. Center of attraction, this one here. So, most of us Asians, Filipinos, okay, we wanted to center the nose.
Yes, of course.
Okay, so because people look at us at the center, even the eye area, okay, and even the lips, right? That's why today, what we're going to do for Phoebe is for the nose area, the non-surgical nose enhancement, and also the under eye area. Actually, I think she's having like nights that she doesn't sleep early.
Insomnias.
In sleepless nights, okay? So some sunken parts under the eye and some minimal enhancement on the lip area because her concern is just she wanted like somehow the upper lip region kind of like pouty or like a bit of there's a presence of the so-called lip tubercles. Yun, parang may shape din. May kwento ang lips, nangungusap. Oh, there you go. Okay. But in this episode, we'll be combining a so-called ultrasound-guided injections. Okay. Here at CSA, we have this device, a handheld device, portable device. Doctora was using ultrasounds before in OBGYN, okay? But in aesthetics, we also use ultrasound right now, especially for injections, like when you're injecting toxins, even fillers, even threads. We can already have a device that will guide us. Where do we inject, right? Are we in the right anatomical layer? Are we in a correct plane? Are we avoiding a blood vessel? Exciting, right?
Yes.
So we have it here now, of course, for the safety of everyone. Because a lot of people have been hearing about complications of, like, especially filler injections. Anatomy is so significant. We should have a very thorough knowledge of anatomy, okay? Yes. So to avoid complications like those, because we've been hearing those kinds of like fear or like people are like afraid of doing these injections already. So to make you feel comfortable, like you know you're in safe hands, we added technology of ultrasound. Okay? So how do you feel, Phoebe?
Kind of nervous.
Nervous?
But also excited.
Excited, yeah. Because the others are like afraid of the needle, eh.
Yeah.
Diba?
I'm used to
Fear
it,
of needle. Yeah. So others are like concerned about, is it painful? Like that. Diba?
Yeah.
Even doctors are afraid of needles, eh. But the thing is, as we say, no pain, no beauty.
No beauty.
No beauty. Okay. So we'll show the procedure when CSA Medical Aesthetics return. back. So a while ago, actually, we did an ultrasound guidance mapping of our blood vessels, the structures, like the soft tissue layers. Okay, so we now know where to avoid. Okay, what are the vascular regions where we should be avoiding our injections. Okay, so we have 3 procedures for today: the nose enhancement, like an under eye enhancement, and also some lip enhancement, okay, in a non-surgical approach. Okay, so initially we have to numb the area. You can actually apply a topical numbing cream, or you can even use like a pain freeze. I have here like a cryogenic spray. You're still good, Phoebe?
Yeah.
Okay, something cold lang. So sometimes we call this like a gate control theory, like diverting any sensation. And there you go, a tiny spray only. And then we have a lidocaine that we inject at the entry point. Usually our infra-tip is our entry point, like a minimal prick only here. Inhale, exhale, Phoebe, tiny prick. So usually we feel the burning sensation from the lidocaine, but somehow it's tolerable. Once we've done this, we're good. Okay. Sorry for that tiny prick, baby. I understand. Have done that. Okay. So I'll have this gauge 19 needle for my entry point, and then we'll be using a hyaluronic substance. So we'll do a combination for Phoebe. So we want somehow a volume also on the dorsum of the nose. And we have a Hyg Prime, hyaluronic type of a filler. So we'll glide this in. So a while ago, I've seen the soft tissue layers here. So I'll go on the deepest anatomical layer. So usually Asians, we Filipinos have round tip, and we have a lot of like fatty tissues in our nose tip area. That's why in my treatment, sometimes I incorporate fat dissolve injections. Have you heard of that, Phoebe? Fat dissolve injections. Yeah. So we call it mesonose injection. So I'm already pushing a little bit of my hyaluronic substance, very tiny amount only, minimal amount. Just wanna create like a good volume on the dorsum of the nose. And following the midline, the center of the nose, pushing a little bit, gradual. So I'm actually using a gauge 22 cannula here. So in the same entry point, you can direct it towards your columella there. So actually we have a space here. Really still fine. As much as possible, we want to be gentle. Gentle technique is a good technique. Okay. So the goal here is to reach your anterior nasal spine, especially for Filipino nose. What you need to fill in is that anterior nasal spine, because Asians, Filipinos, we have flat anterior nasal spine. Unlike the Caucasians, it's elevated. So when you study the anatomy between Caucasians and Filipinos or Asians have flat anterior nasal spine. So now we'll be adding our PDO threads. Okay, we want this to, since it creates that definition, call it nose definition. So we just glide it midline. Okay, you can use like 5, 6, 8 to 10. The most that I did use on my patients, some of my patients I have used the most was up to 20. So it also depends on the anatomy of the nose, the height of the dorsum, the length of the nose, the width of the nose. So it's a case-to-case basis. Okay, some people will need more, some people will need less. So we have to do an anatomical assessment. So we're doing the bridge. Okay. And then once we're done with the bridge, we proceed to the tip columella region. For my tip columella, I make a second entry point. Especially Filipinos have short columella length. So I'll use a short PDO thread and then pinch the columella there so you can feel the advancement of your cannula into the space. Okay, I'm just gonna glide a bit. And then after that, we're gonna pull it out. So depending on the length of the PDO that you have, some have like 30 millimeter length or 40 millimeter length. Then after the nose, I'll do the correction of the tear trap area under eye. So I make an entry point here paint freeze, please. So we have to numb the area. So this is spraying it here. Sorry, loves. Yan. Ideally, you have to wait for the frosting of that one and make an entry point in the area. Pinch and we glide. So here we need a fine filler, a low molecular weight filler, small particle size, because the skin under the eye, of course, it has a thin skin. Actually, in our face, the thinnest skin area is in the region of the nose or radix of the nose, and also in the tear trough area or under the eye. Thinnest skin layer. So when I want to do my under eye correction, I can do the technique like this, but the amount of the filler is just tiny aliquot. Very minimal amount of the filler only, especially in the tear trough, and injecting very tiny dose. Okay, and I'll also inject into the lateral canthus to give that lifting effect on the lateral canthal area, to kind of also make the corner of the eye lifted, because some of us have droopy eyes, hooded eyes, or downturned corner of the eye. Okay, then we'll do the left side. So this is a combination 3 procedures: under eye, nose, and also lip filler. Okay, there you go. So actually, the cold part, it's kind of like there's like a gulat effect, right, Phoebe? But after that, you're good. Okay, so tiny prick. So when you spray that cryogenic anesthesia spray, it gives that like few seconds, skin is numb already. So you have to inject right away. Sorry, Phoebe, for that gulat. Okay, you're good?
Yeah.
Yeah. So some like tiis ganda, a little bit of that. But the discomfort is tolerable actually. When I'm inserting this, you're good, right?
Yeah.
So again, I'm injecting in the tear trough minimal amount. What I do right now is I spread the filler in that tear trough section, and I'm placing it submuscular or beneath the so-called orbicularis oculi muscle. Then I'll fill in also the lateral canthal region. Then after this, we'll proceed to the lip area. Okay, so face me, Miss Phoebe. Okay, directing it towards the lateral canthal region. So this is doing 3 procedures in one sitting. Because some people are asking me, can we do it at the same time? Yes, that's possible. It's very possible to do procedures like this in one sitting. Okay, so I'm gliding it towards the lateral canthus. And again, anatomical layer, I put it is submuscular. And minimal amount only. Especially Phoebe is very young. She just needed some minimal volumization of the under eye area. So for now, the lip area, okay, spray again. Okay, close lips. Just gonna like pinch a bit. Okay, like gulat lang because of the sound. It's just the sound. It's not painful actually. Because I also use this pain freeze whenever I do my injections of my face. I like the numbing effect of this one. Plus, it's cold, so it prevents bruising. Okay? Especially Phoebe is busy. She can't afford to have a long downtime, and she doesn't want to have that much of a bruise, right? Okay, for Phoebe, what I'm gonna do is highlight those vermilion borders. Just a little bit in the Cupid's bow. We're using small doses for her only. Yeah, just tiny pricks here, okay? There you go. And then we're gonna glide a bit. So this is a so-called linear technique, retrograde technique. Minimal dose only. Okay. Very good. So once you inflate a little bit, you're seeing the contour of the lips already. So it's just a little bit of contouring. So this is the last procedure, Phoebe. You can do this. I understand the like a feeling of a bit nervous whenever you do injection procedure, especially we're doing 3 procedures on her. And I also have the so-called lollipop technique, whereby we enter from the edge, superior border, and then go to the vermilion, the body of the lip. So if you want to do the so-called tubercle restoration, so you want to bring this out, okay? So what you can do is inject here. There you go. So again, the anatomical layer here, as much as possible, is stay superficially. Because the blood vessel, the labial artery, is at the side of the wet mucosa actually. Okay? So little by little, because Phoebe doesn't want too much. She doesn't want an overcorrected lip. Okay? And then a little bit here. Then after that, we'll just be doing the lower lip tubercle. And she also wants the upper lip tubercle. Okay, so this is the upper lip. And then in the center tubercle, upper lip tubercle, just pinch and tiny inject here. And then we'll be proceeding to the lower lip. In the lower lip, I'll be needing the so-called like a stick on the center to create that there small amount. And there you go. So follow the center of your philtrum. There you go. Press midline and hold those lateral tubercles, pinch and glide and push a little bit. So a while ago we did the mapping of the blood vessel, just a minimal, and then here a minimal or low dose only. So if you want to still aspirate, you can still aspirate using your same injecting hand and push the product. So since you're superficial, you'll expect sometimes you'll expect this kind of sudden bulge on the lip area. And after this, you can actually do massaging of the filler substance, okay? So we'll massage the lip. And so we've done 3 procedures for Phoebe today: nose, under eye, and lip. We'll show the result when CSA Medical Aesthetics return. And we're back, so we're now showing the result to Phoebe. Hi, Phoebe. Here's our mirror.
Oh my God.
There you go.
Oh my
Yeah,
God, Doctor.
right. We did 3 procedures in one sitting, okay? And with the ultrasound guided mapping of the face. So for Phoebe, in summary, we did the nose enhancement using our combination filler and threads. And we also did tear trough correction or the under eye area using a fine soft filler. And for the lip enhancement, in a way, it's just like contouring at the same time, minimal volumization using also our lip filler. So there you go, Phoebe. So far, so good. Okay?
Yeah,
Yeah.
I'm so happy.
What do you think?
Very proportional face. So thank you so
There you
much.
go. That term, Doctora, proportion. So actually, in doing non-surgical aesthetic procedures, we follow ratios and proportions, angles, and the right rotations, and symmetry of the face, the left and the right. Because actually, we really have an inherent asymmetry, okay? Yung isang mata, smaller than the other, or yung nostrils, yung isa,
Larger.
yes, than the other side, okay? So whenever we do assessment ng left and right side of the face, all aspects, all parts, all regions of the face, we always see like an asymmetry. Even your eyebrows, right? Like when you're doing this line on the eyebrow, you notice one could be higher, one could be lower, or even the arch, they're not equal, or even the tail, they're not equal, or one could be droopier than the other, or the cheeks, one side can be bigger than the other, or puffier than the other. And even here around the mouth, there's an asymmetry. Even the lip corner, one can be lower, the other can be higher. So those are kinds of things that we look into in aesthetic practice. Okay, so I'm so happy for you, Phoebe. We're so glad.
Thank you so much.
Yeah,
Doctor.
baby face talaga siya. Okay. So after this, we advise them actually some home like instructions. We tell them avoid like allergenic food, yung malalansa. Don't carry heavy weights first. Don't drink coffee too much muna or caffeinated drinks or any blood thinners. Don't take blood thinners. Yan. And just stay happy and beautiful. Okay.
You made me more pretty, Doctora. Thank
We're
you so
so
much.
glad. Of course, there you go. You wanted to make yourself really confident. Beautiful with confidence.
Yeah.
Okay. And I really love her cheeks actually, Dr. Roxanne. Look at her cheeks. She has that good OG curve and looking at the shape of the face. Kasi if you have smaller, narrower face, you look a lot younger. There you go. That's why I thought she's in high school. Okay. And also when you project the nose like that, it's making your face, it's giving the illusion of a narrower and smaller, slimmer face. Okay. There you go. So again, we really wanted to emphasize also safety of procedures that we're doing. So here in our center, we're already using our ultrasound guided technique in doing injections on the face. Even if like we're using toxin, sometimes if I inject the masseter, I still can do check on how thick the masseter is, or even check on the parotid gland here. We can check on that. And it's a good device that even our co-doctors could have. We recommend that you get it too if you're scared in doing injections, but you have knowledge of anatomy and you know your injection techniques. Why not get also this device to help us all, the injectors, and plus also our patients, that they become so like they feel peaceful or not so scared of any complications from this treatment, especially also the injectors, because we doctors sometimes we still think of our patients after doing the injection. The following day we still think about you. We always think about you. Of course, after injections you expect some minimal discomfort, the bruising, the swelling, because we did use needles. Okay, so our face is vascularized. Okay, so bruising and swelling are expected, but these are reactions that will heal over time. Okay. Thank you, Phoebe.
Thank you so much, Dr.
Do you have any social media that they can follow you or check on you?
Yeah, of course, on Facebook, Instagram, and TikTok, Phoebe Go. Yeah.
There you go. She's very young. And sometimes they ask questions about like the treatment only. Masakit ba? Like that.
Yeah.
There you go. And Dr. Roxanne, thank you so much. What do you think of this?
Oh, Doc, and everything is in proportion now.
Yeah.
The height of the nose, the lips, and actually, ang ganda rin po dun sa under eye niya.
Under eye.
So, mas makikita pa natin after a week or so po na, Doc, yung improvement ng right eyes. So, ang ganda-ganda, Doc.
Right. So the good thing is that the results are instant. You can see it right away. It's immediate, and over time, it's still improving. And these ones, these kinds of treatments, we could say like minimal for others to no downtime. The others like they don't even bruise or swell at all. Okay. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And also watch our other videos at our YouTube channel, Contessa Salvador. And please do subscribe. Thank you so much. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.